My name is Dr. Michael Samaha. I'm the medical director for the respiratory therapy department and the sleep lab at the Bay Health Sussex campus. I knew when I was young when I wanted to be a doctor because first there was no doctors in the family, and then it became more of a challenge and to make people's lives better. I can't define it at that time, but it was something I always wanted to do and pursue, and I had to overcome a lot of obstacles to get there. I come from a country where there was war, and I had to study in between wars, and there was a lot of hardship to get there, but we eventually did, and I always wanted to come to the United States, so there were a lot of exams to take and studying to do in the hardest conditions, and I was able to, thank God, and did it. So I was always fascinated by pulmonary physiology and what the lung function was, and then I had mentors that really steered me to stay focused on it, and I always loved it. It could be very rewarding to help people ease people's suffering, breathing, and other issues, and the more you're in it, the more you discover you have to know a lot more to become better. It's a whole world out there. I first came to the United States in '96, where I had my residency, and I was a chief resident for a year in New York, and then went to Oklahoma City, where I had my fellowship in pulmonary and critical care, which I always wanted to do. And then eventually came back to Delaware, where I had some acquaintances, and started in a small town, which grew up on me really, and eventually decided to stay because I had a lot of support from the hospital, namely Bay Health really, and most importantly the community and patients. You have to have a trust relationship between me and my patients. I have to have that, because if I'm going to make a recommendation for their treatment, if they don't trust me, they will not comply or will not get better. And if I don't explain why I'm providing this treatment or why am I doing this or the other, patients won't just take it and go with it. You know, their quality of life, their outcome eventually, or their loved one depends on that. So they need to have all the information and be educated as much as possible so that they take the right step and move in the right direction and get better, which is ultimately the goal. So my relationship with my patients is what drives me, because it becomes very personal, and they become really like family and friends. But for most of it, I am very proud of my patients and my relationship with my patients, because at the end of the day, it's ultimately what you want to feel fully satisfied before you go to bed every night, and know that you have done your best to improve somebody's quality of life.